couple of months ago, I went on holiday to Spain and I did some things, I'm not very proud of. I slept with a few people, had too much to drink. I can't really remember who they were, if I used protection or anything. So, I know I should have gone to the clinic before now, but I've just got up the courage because I was really nervous because I've heard all kinds of stories and stuff. But I'm going to go to the clinic. I'm really nervous and a bit scared, but hopefully everything will be all right.
Good morning.
Hi, good morning.
I was wondering if I could see a nurse.
Have you been before?
No, I haven't.
Can I get you to fill one of these forms in?
Okay.
Just have a seat in the waiting room and then bring it back.
Okay, thank you.
Thanks.
When patients come into our department, patients will be asked by the receptionist to fill in some documentation just so we can take the personal details. Then they will wait in the waiting room while one of the clinicians will call them through to take their history. When we've took the history, we will then ask our patients to go into the clinical room, do a quick examination and then do the appropriate tests that need doing. I need you to do a urine sample for me where we can check for chlamydia and gonorrhea, and then I need to do a blood test where we check for HIV and syphilis. A lot of the guys that come into our department are quite anxious because they hear lots of rumours about an umbrella. It's nothing like an umbrella. Our tests have advanced now that we do. And to check for gonorrhea, it's just a urine sample. To get the results from all our investigations, it would take a week to 10 days. Hi Mike, this is David, our health advisor that I was just explaining about. They will be asked to see the health advisor. The health advisor's role primarily is to kind of reinforce what's happened, discuss risk with them, safer sex and partner notification if needed.
I would advise that you use condoms at all times in the future, which I'll give you some now.
Okay, thanks.
Well, people tend to think it's just after having sexual intercourse that you're at risk of sexually transmitted infections, but oral's one of the big ones. There's lots of infections people can get by having oral sex. So look forward to seeing you when you come back for your results, and try not to worry too much.
Okay, thanks a lot.
Alright.
I'd just like young people to know that everything that happens in this department is strictly confidential. We're respectful, we're not non-judgmental.
Well, basically, I went out last night and got a bit drunk and had sex with someone, and I wanted to go to clinic to get morning after pill because I don't want a baby.
Hello.
Hi, I've got an appointment for 4:30.
Right, what name is it?
Jodie. I'm feeling really nervous about going to clinic because I've heard loads of stories off my friends and she's going to ask me loads of questions and pry into my life and everything.
You could just take a seat and fill me this form out and then bring it back to me. Thank you.
A person would come through the door, arrive at reception. They usually tell reception what they want. They can go into a private area to do that if they want to. Reception would then give them a form to fill in, which has got the details on, such as a name, address, date of birth.
Jodie Micklethwaite, please.
She would send them up to the medical floor where we see the patient, and then they would be seen by a nurse or a doctor. Hello, is it Jodie?
Yeah.
I'm still the nurse. So what can we do for you today?
I'm here for morning after pill.
They would first establish whether it was necessary to give a person the emergency pill, and then if it was, they would take a history to make sure that we're giving it safely, and they would explain about the emergency pill effectiveness and side effects, and they would advise that they come back in 3 weeks' time for a follow-up.
My parents aren't going to find out or anything, like notes getting sent home or all like that.
No, you have asked for no letters home, so we put a big red stamp on your notes so that nobody's going to miss that you don't want any letters home. And even if your parents rang, we couldn't even tell them that you'd been, never mind what you'd been for. Okay then, Jodie, so that's the emergency pill, and there's some condoms for you. I've got a mixed bag, is that alright?
Yeah.
People usually request. Within 24 hours it's about 99% effective, going down to about 95% at 72 hours. The message is the sooner you take it, the more effective it is.
I've just got a new boyfriend, so we're thinking about taking it to like the next level and having sex. I wanted to go to the GP clinic to ask about contraception. I usually go to the same GP, so I trust her.
Good afternoon, how can I help?
And she knows a lot of things about me, and I'm a bit nervous because she's also my family's GP.
Young people are told when they first arrive and have their first appointment that this is a confidential appointment and it will not be breached by anyone outside wanting to gain information. Many of the young people that come and see me know, because I've told them to say it's personal. In this way they don't have to go into in-depth reasons why they're needing to see me, and they know then which clinic to put them in.
Hi Jade, my name is Maxine.
We offer a full contraceptive clinic.
Would it be more useful for you if I took you through what's available for you, gave you information, you think about what you'd like?
The contraceptions that we offer are the combined pill, progesterone only pill, the Depo-Provera injection, Implanon, and condoms. A lot of young people listen to their friends, and sometimes it's like Chinese whispers. By the time it's started off at 1 and gone round 5, the information they've got is wrong.
Thank you.
Okay, I think it's important that when young people have had their appointment, that when they leave, they feel comfortable so that they can phone and ask any questions, and that the consultation just doesn't stop on that day.
All my friends have said that like you can get free condoms by getting this card. You can go in and you can collect them anytime. It's a good idea because I think they're too expensive for younger people to buy, and if they're having sex then they're going to need them, aren't they? So they don't get STIs and pregnancy. I've heard you do C-card here.
We do, yeah.
Could I speak to who handles it, please?
You can, yeah. Just want to go through and have a seat through them doors and somebody will deal with you.
All right, thank you.
Okay.
The C-card scheme works by allowing young people to access free condoms wherever they're already accessing services out in the community, so it's in several locations throughout the borough. When any young person comes in to register for C-card, it's completely confidential, and in a private room they'd have a discussion with a nurse or a healthcare assistant. Hi, you wanting to register for C-card?
Yeah, I am.
Do you want to come through?
Yep.
We would ask them various questions about general sexual health, just giving information about health promotion. Are you in a relationship at the moment?
No.
You're not. Have you used condoms already before?
No.
About other methods of contraception and general sexual health advice. We would also make sure that they knew how to use a condom properly, about safe condom use, and we would give a demonstration as well. And you need to roll it on all the way down to the bottom. Obviously young people are embarrassed, and that's quite normal, and we take that into consideration, but it's good if we can have a laugh about it as well, because it should be about having fun. Okay Grant, so this is your C-card, and wherever you see the C-card symbol you can access up to 6 free condoms. Nobody would know that you'd access the service. It is completely confidential.
Drop some condoms, please.
You can, yeah. Thank you. Just take your number. That's that. There you go.
All right, thank you.
Thanks, bye.
If you wanted to know where the centres were for C-card, you can look on our website. There's an updated list on there.
I went the other day and it was alright actually. It wasn't bad at all. I didn't have anything put down there or anything put up there, so it was alright. Everybody was really nice.
Yeah, I went for contraception. A bit worried about it because, you know, we were about all that intimidating type stuff, but they weren't that bad. It were really good.
I went for C-card, very friendly. Just gave me a load of condoms and I were on my way, so didn't really take that much time.
Well, I went to talk about morning after pill, and I was right worried because my friend went before, and she said, oh, they were horrible, and they were asking her all sorts of questions and all this. So I went and I was really nervous, and I went in and she was dead nice.
I felt before a bit like you know, you're going to go and it's going to be like your parents sat there going, but it's not. They're there to help. You know, what you tell them, it's not like they won't have heard that before. So.